Welcome back. It's the Scaling Secrets podcast. Dr. Steve Schutzer, MD from UpswingHealth.com is here, and we're going to be talking about healthcare, about the future of it, healthcare leadership, AI, and so much more. Steve has this company called UpswingHealth.com, and he also has a very excellent podcast called MTVA Unscripted, Moving to Value Alliance. So Steve is going to educate us and tell us what we need to know about the healthcare ecosystem, about how things are changing, the disruptors in healthcare, and most importantly, what Steve and his companies have done as far as just changing things and how they affect us. And we might even learn some fun business scaling and growth lessons along the way. So Dr. Steve, glad to be speaking with you.
Great to be here, Robert. Thank you for having me.
Glad to have you. And so we introduced you a little bit, but in your own words, like what is your current focus and passion? What just has you really fired up, excited these days?
Yeah, I started, so I'm an orthopedic surgeon. Do you go by Bob or Robert? What do you like to be called?
Always Robert.
Robert. Robert, I'm an orthopedic surgeon. My subspecialty interest is in joint replacement. So some people call us a sterile carpenter. I just fix broken parts, and I've done that for many, many years. And my fellowship mentor, Dr. William Harris, is still around at 94 years of age. And when I was his fellow at Mass General, every morning, Robert, he would say to us, I was 30 years of age, he would say, Steve, you got to leave it better than you found it. And it was like every morning I go, yeah, sure. I just want to get to work, sir. but little did I know that actually stayed with me for my career. Went into private practice here in the Hartford community. Love what I do. But something started as I approached 50 years of age. And I loved orthopedics. I was an innovator, developed some implants and so forth. But those words were ringing in my mind. How do I do it better? Leave it better than you found it. And at the time, around 2007, things started to heat up. And Professor Porter and Professor Kaplan deserve a lot of credit to Harvard Business School for creating a new value, a new way of delivering health. This is now 17 years ago. Have we made progress? We can talk about that, Robert. I hope so. But we became sort of aligned with the Harvard Business School and their philosophy of looking at healthcare as a value equation, outcomes over cost. If we're an orthopedic surgeon with a very left brain mentality, it's very clear. You want to measure healthcare by the outcomes. And what I mean by outcomes, Robert, the outcomes that matter to you if I'm going to do your hip or knee replacement. What are the outcomes that matter to you over the true cost of delivering those outcomes? Very pragmatic, very realistic, very tangible. And I read 3 books. One of my colleagues, Kevin Bozick, who's the chair at Dell Medical School, asked me to read 3 books, all by Harvard Business School professors. It was Who Killed Healthcare, Innovator's Prescription, and The Redefining Healthcare by Professor Porter. Each one of them probably took me a year to read because they were really dense. But when I finished that, I said, you know what? This is absolutely crazy. It's probably now 2008. The way we're doing things here, siloed, dysfunctional, no communication, fee for service, getting paid to do something, getting paid twice as much if it fails and you have to redo it, made no sense. So I was inspired with a bunch of other people to look at joint replacement and build a center of excellence. And a real center of excellence. You see billboards, we're a center of excellence, but I mean a real bona fide center of excellence. We could talk about what that means for hours, and we just don't have the time to do that. But we did that. We pulled together 10 orthopedic surgeons from different practices, none of whom were short on ego, right? They're all going to do it, my way or the highway. But we managed to put them together and say, you know what, there is a better way here, guys. And I think we can all do better. Our patients can do better. Our hospital can do better. We can do better. How do we do better? In 2007, I was doing 3 cases in 8 hours. In 2009, I was doing 8 cases in 3 hours. That's how we do better, by creating protocols and following protocols and so on and so forth. So that became really my reason to live. I mean, we built this program called the Connecticut Joint Replacement Institute. at St. Francis Hospital, and we built it for joint replacement. And it's funny because you'll learn a lot in healthcare about human nature. And I can't tell you, Robert, how I've become a bit of a social scientist, but you have to if you want to change behavior. Yeah, the model was so successful that my colleagues who were spine surgeons, who initially said, Steve, you're sucking up all our resources, you're leaving nothing for blah, 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 suddenly said, hey, this seems to be working pretty well for you. Would you mind sharing your operating agreement, your co-management agreement, all the intellectual property we had created? He said, here, it's yours. Save yourself $10,000 in legal fees. So we spawned off a spine program. Sure enough, orthopedics has these subspecialties. My colleagues that were sports docs then said the same thing. They said, boy, this is working out for joints and spine. We want this too. So we did the same thing. We spawned a sports program and finally a trauma program. So we had spine, total joints, sports, and trauma, which is pretty much all of orthopedics. And we created an orthopedic service line, but all with that same framework of looking at outcomes, looking at data, creating protocols, measuring our measuring our outcomes and so forth. And it was really one heck of a journey, fabulous journey. No one believed we could pull it off, but everybody did well. Most importantly, Robert, our patients did well. They would come into our unit and say, everybody seems to know what they're doing. It feels like, are you, but people have such a low expectation today of their healthcare experience. We dazzle them. It was that good. After 16, 17 years of doing that, it was time for me to hang. First of all, I hung up my scalp. I stopped operating about a year ago. And I also wanted to give up all of my administrative roles because I never wanted to be a suit, a three-piece suit and a tie. If I wasn't in the trenches with my guys, then I wasn't going to administrate. So I gave all that stuff up about a little over a year ago. And I then put all of my efforts into two companies. One of them is called the Moving to Value Alliance. It's actually a nonprofit that 5 of us started 7 years ago. And like many of these movements, Robert, it starts with a couple of good ideas, some passion, some vision, a lot of energy, and a commitment to change. And we started a little working group, right? The working group grew and grew and grew. And pre-COVID, it grew more. And over the course of time, we put on, hundreds of webinars and symposiums. And we actually became a 501c3 about a year and a half ago. And now we're primarily producing content, our podcast. We do 2 a month, have speakers from all swaths of healthcare. But it's our way of giving back. All of the folks on our board, they come from various disciplines and stakeholder communities, just want to give back. So I spent a lot of time with the Moving to Value Alliance, but also this company that my partner, Dr. Jay Kimmel, who's a sports doc, thought about probably 5 years ago. So here's the deal, Robert. We feel that I don't want to say solved, but we really created a model for brick and mortar healthcare that's franchisable. In fact, we have a little consulting company. I could build one of these anywhere in the country, and we have. It's a question of getting the right alignment of the docs, the alignment of all the stakeholders, blah, blah, blah. So we did that, but also the good news is that most of orthopedics is not in the operating room, right? The whole idea is to avoid the operation. So Jay and I said, the world we live in is completely dysfunctional. And if you read Who Killed Healthcare, or if you read Marty McCary's last book, The Price We Pay, we all killed it, right? You can point your fingers at insurance companies, at hospitals. We can point our fingers at ourselves, right? It's a systemic problem. We don't blame anybody. But the reality is, so much of orthopedics is complete and utter waste. And I won't go into all of it, but we know that. My partner and I know that. We live that world. We're private practice orthopedic surgeons, and it's no different if you're employed. It's so much of it is waste. But if you talk about unnecessary surgery, like spine surgery and so forth, I hate to put that in the category of waste, like a wasted MRI. These are people's lives, right? This is not, wasted MRI scans, wasted cortisone shots. These are people's lives, and some of them have very horrible outcomes, become addicted, and so forth. So we set out to gut it. And Robert, you've been around a while too, that when you have a complex system, you can't nibble at the ankles. You got to blow it up and start over and have the fortitude and the wattage to say this is the way it should be done. And then what you have to do then is fight all of the incumbents who like it just the way it is. That's not easy stuff. We talk about changing healthcare. But at any rate, we set out to say, let's reinvent orthopedics. That's the world we know. But the model we've created can be done in any healthcare discipline. It's very simple. And it has to do with the three pillars that we created of Upswing Health. So, Robert, you have an injury, right? You roll your ankle later today, God forbid, and it hurts like a mother, right? You have two questions. What do I have and where do I go? That's the first two questions. Well, now you know, Dr. Steve, you can call me up and say, Dr. Steve, I rolled my ankle. What do I do about it? And I'll ask you some questions. I'll say, if you can walk on it, go on Amazon for $23 and buy an ankle splint, take some Advil, put some ice on it, blah, blah, blah. You're done. You don't have to go to the ED for $2,500. You don't need a cam walker for $300, and you don't need x-rays, right? So this is what we did. We created technology first. This is now 4 or 5 years ago. So think about this. We knew then that technology was going to be good enough to answer the questions. What do I have and where do I go? What do I do? And we built a symptom assessment tool that we can show you sometime that answers those questions. You go onto our site, you point to where it hurts, it'll ask you a series of questions, the same questions I would ask you in my office, very serious, logical plan, and it gives you a differential diagnosis and tells you what to do about it. It's not perfect. It's about 75% accurate with the older version. We're just releasing a new version. We think the accuracy will get into the mid-80s, but it gives people some good general advice. Sometimes that's all somebody wants to know. I don't need to go to the ED right away, right? Let me try it for a day or two and see. So we present technology first. And as you know, to no surprise, Robert, the technology is getting better and better and better, right? It's only going to get better with time. We use decision tree algorithms, not Gen AI yet. We're looking at that. But anyway, this is what we do. So we present technology first. But everybody, all humans, ultimately want to talk to another person. It's just now, even the 20-year-olds sometimes want to talk face to face. So our frontline human contact is with a cadre of individuals known as athletic trainers. Do you know what athletic trainers are, Robert? ATs?
No, no.
You've seen them. These are the folks that run onto the field to take care of the injured football player, the basketball player. They're called certified athletic trainers, or ATs for short. They are probably the most undervalued stakeholder in orthopedics. They not only college graduates, but they have 1 or 2 years masters in kinesiology and physiology. They've been in the locker room taking care of athletes for many, many years. So we brought them on as our front line. And what they do is they'll go on with you, Robert, ask you some additional questions based on your symptom checker. We now have some really cool technology on our phone that can do some objective measurements of your range, all this stuff called motion tracking. And then they'll give you a list of exercises to do, video exercises. But then they do something, Robert, that I've never been able to do in my 37 years. They'll say, hey, Robert, I'm a little concerned about that ankle, your shoulder, your back. Let's check back in 5 days. I just want to make sure you're doing okay. What does that do? It builds a relationship with you, right? Actually, somebody cares, because there's a perception no one cares in healthcare. Number two, it makes sure the patient doesn't say, I really do need to run to the orthopedic surgeon or the ED. Keeps that thing, and it keeps them accountable for their own outcome. So listen to this. With our technology and with our athletic trainers, we're managing about 80% of low and medium acuity orthopedics. Not 100%, about 80%. So imagine 80 out of 100 patients went to my office instead of using Upswing, or they went to see an orthopedic spine surgeon, or you can imagine the difference in cost, right? We're very inexpensive. But let's face it, sometimes folks do need to escalate up to the physician level. And we have 9 physicians that work with us. 2 are orthopedic surgeons, but 7 are primary care sports medicine docs. I don't know if you're familiar with it. These are primary care docs that went back to become orthopedic specialists by doing a fellowship in orthopedic medicine. And they'll jump on a Zoom just like we are now. They'll ask you more about your particular problem. Today, Robert, I can give you medication if you need it, not opioids. I can order an MRI scan, a CAT scan, a bone scan, all of that, all virtually, and keep you in our family. Now, with all of that, we're managing about 90% of orthopedics, all virtual at a very inexpensive price point. But we need downstream colleagues, right? We do need orthopedic surgeons. I'm one. I like to operate. We do need physical therapy, virtual and brick and mortar. We need chiropractors. We need stem cell companies. So at that point, Upswing becomes an agnostic triage tool. All right. So we've managed your back, let's say, Robert, for 4, 5, 6 weeks. You're not getting better, getting a little tingling in your foot. We know the next step. Got an MRI scan for you. Now we got to find the appropriate resource. It might be a pain management specialist. I might be concerned that you're getting some weakness in your foot. You need to see a neurosurgeon. If it's your knee and you've got some early arthritic changes, I might refer you for stem cells. But think of all of the curation. Think of all of the management that we've done in a big funnel to get to that point of knowing where you should go. So you don't need to be a healthcare economist to see the value that this model creates. And we've proven that value. We've got results to prove it. I always like to boast about our NPS score, Net Promoter Score, of 85. I mean, the average Net Promoter Score is 56. And there's one major payer I won't mention, the Net Promoter Score is 1, right? And our Net Promoter Score of 85 has nothing to do with me or Jay. It's our coaches that engage and re-engage and motivate. And, as a chief medical officer, I go in to their to our EHR health record. I look at their notes. I make sure they're doing the right thing. I check off on it. And it's just amazing to see the quality of the human interaction. So our Net Promoter Score is 85. 76% of our users said next time they have an orthopedic problem, they'll use us. Listen to this. 59% of the patients that used Upswing said that had they not used us, they were going to the ER or to the urgent care, right? 46% said had they not used us, they were going to run to the doctor's office. So the model works. We did a pilot study here. I'm in the state of Connecticut. Excuse me, as I mentioned. We did a pilot study here in the state of Connecticut with 25,000 members of the state health plan. And, we saved them $1,100 per member and reduced orthopedic encounters by 38%. That's real, right? Imagine if those patients, and again, this is not pointing any fingers, it's reality. So that's a little bit what Upswing does. We're very proud of it. We're out there. Our major market, Robert, is with self-funded employers. But that's a big swath. You don't get to the employer directly. We get to the employer via TPAs and brokers and consultants. And all of our primary care colleagues, direct primary care, virtual primary care, we love the company called Galileo and Recuro, advanced primary care companies. So if we can latch on and become a wagon as they move to the self-funded employers, then we all win. But we also are in Medicare Advantage. We're starting a program the end of this month in July with Scan Health, a 5-state MA plan. So I think you get a sense for who Upswing is. We are a top of the funnel on-ramp for anybody with MSK, low and medium acuity MSK. We apply filtration using a bunch of different techniques, both technology and people, to get patients on the right pathway from the start. And our feeling is, Robert, that in the next 3 to 5 years, every service line will be virtual first. Why? It's inexpensive. It's scalable. It solves the vast majority of problems virtually. But even when you can't solve the problem, you know where to direct the patient, as opposed to, hey, Robert, go find a physical therapist, go find an orthopedic surgeon, go find a rheumatologist. You have no idea where to go, right? So that's a bit of what we do, and that's what I get up every day ready to go. And it's about change. The headwinds are fierce. We're talking about, as we started the conversation, is changing hearts and minds of incumbents, legacy incumbents who are doing very well in the status quo. So it's an uphill slog, but there's a lot of momentum building, we feel, and not just for orthopedics, but for all of the. So think about this, and I'll stop blabbing and see if you have any additional questions. But 40% of my patients are obese as an orthopedic surgeon. Well, that's not surprising, right? Half of them claim anxiety and depression. A lot of them have diabetes. So why do we look at orthopedics in isolation as a so-called point solution? We can't. We got to collaborate horizontally. So we're working with partners in obesity medicine, behavioral health, diabetes, and all these other disciplines have to collaborate around the focus of our attention, which is the patient. So that's what we do, both in nonprofit world and as our friend Stacy Richter, who's got the #1 healthcare podcast called Relentless Health Value. Put a plug out for Stacy. Let's do well by doing good. There's plenty of room for that.
And leave it better than you found it, as you said when we began this conversation. And so this is amazing. And I mean, we said about 5 podcasts worth to get a feel for you, but that's great. And it's wonderful to get a feel of your mindset here, right? About how it seems like you're just really about the deep thought and how do we solve these problems and what have we not considered and what am I bumping up against and what am I just frustrated with in the industry? And this is just some really cool things that you've accomplished here, right? As far as like showing how it could be done and other people saying like, hey, can we use this as well? And so like you said a lot and I'm still digesting a lot of it, but what I'm really curious about is your difficulties, your stresses, and you might be thinking like, well, all of it, right? Every step of the way. And so it's what we like to hear about are some fun stories about where maybe at any point did you think about giving up, or were you really blocked at any point saying like, hey, I don't know how to like get through to this group or how to solve this problem? Like, what have you really stressed about or just felt like quitting or changing direction as part of your journey?
Yeah, I have a condition called EO, eternal optimism. So it's hard to get me down, but we do. I mean, moments where the headwinds. You think about the fact, Robert, that 5 companies control 20% of our economy. That's a lot of capital. Remember, 1/3 of that is total waste. But somebody's making a lot of money with that waste, and it's very frustrating. Healthcare is imminently solvable. I work with hundreds of people that would come together and solve it easily. But again, the resistance to change and the power of the incumbency is really, really tough. But the other thing that I do, and I learned a lot, I still learn. I read every day. Here's a great book I'm going to pitch here called The Myths of Motivation, or the Motivation Mythbusters, because there's a lot of myths out there. But, you just got to, I live for bright spots, right? I find a bright spot and I cling to it. Otherwise, you're throwing spaghetti at the wall and nothing's going to stick. So, for example, this little piece of legislation I'm teasing called the Consolidated Appropriation Act, the CAA for short, that is monumental. This federal legislation that commands plan sponsors, employers, to act as a fiduciary for their employees, right? But that's a very high. I don't want to get into that. That's a whole nother podcast I can talk to you about and get somebody to help you out here. But the CAA is the most impactful piece of federal legislation in 50 years. Now, does it take place on day one when President Biden's, I think it was actually President Trump signed it just before he left office, but it takes a long time for that legislation to percolate through the marketplace. But it holds great promise because now the employer can't say, I'm going to just check the box for orthopedics and check the box. They actually have to look at the outcomes for their employees. Is what they're buying for you, is it worth it for you? Is the money they're spending on your behalf, is it helping your health care? It holds a very high fiduciary standard. So, I mean, that's a bright spot that folks in my seat are really clinging to. And then the whole movement towards transparency, you probably picked up a lot on this. There's bipartisan support for transparency on PBMs, on all of us, brokers, physicians. So there are some bright spots. The question is, what concerns me, Robert, is time. We're really running out of time. People are going broke. I know folks that we talk to that don't have a lot of means can't afford the medication. You can't afford a 500, go to the CVS and get a $500 bill. That's a quarter of their month's pay. It's tragic. You know, financial toxicity is clinical toxicity. Stacy Richter, right? So we're kind of running out of time. And I don't want to get into the whole concept of single payer or other system, because that's a whole nother conversation. But, you know, it's when capitalism runs amok, this is what we've got. And we've got to rein it in pretty quickly because we're going to run out of time.
And it's good to have the awareness of some of this, right? I mean, it's like you said, this is huge, and there's all these kind of issues and problems and people that don't want it to change. But you also said it's imminently solvable. There are these bright spots, and my brain keeps going back to some of these ideas that you're mentioning about like the outcomes, and you mentioned a few times this keyword pathways, and I find that just really it ignites the imagination, right? Thinking about your goals or thinking about when you have some patient with a problem, you're like, well, what's the path that they take, right? Do you do the telemedicine and figure this out for the next 5 days? Do you route them over to the specialist, the surgery? It's all kind of like how, you know, automation and funnels are big in the digital marketing world and online space. It's kind of it's cool to think about, and especially just anecdotally, personally, it feels like every time I visit the doctor lately, it feels like no matter where I go, they have it a little bit more dialed in, right? They have a little bit more digitized. It seems somehow like cleaner, faster. The customer service seems to like kind of be on their game. They seem to be friendly. It's been quite a while since I had a really like terrible experience at any kind of like medical visit or doctor. So it feels like, kind of speaking to your optimism, your bright spots, it feels like it's like slowly, incrementally getting better. But as you said, time is of the essence. We really want to get there. And that's why your site and your podcast is a great way to dive into some of these deeper subjects. But I want to kind of move on to one last little block here and talk about why we're here is scaling secrets, because you've done a lot of things right? You mentioned a lot about these people that have helped you and people that you contacted and the technology. And I want to make sure that we get some last couple of nuggets from you as far as this whole idea of like scaling a business, right? It's scary. It's a huge undertaking. Lots of ways to go wrong. People want to do it. So what do you think that you uniquely have done well that maybe others miss out on as far as scaling these companies you've built?
Yeah, that's a great question. And listen, it takes time. I've been processing information for really my whole career. I latched on to individuals that I said, geez, how is that guy so smart? And I don't mean just smart by IQ. How do they read the room? How do they listen? You know, so I've had many mentors that I have kind of latched onto, and I've processed and I've read and I've processed more. And I train in martial arts, and I've learned a lot from my instructor about things. And you start to absorb, and you form your mental framework, and then you test it, right? You test it, and you go, this didn't work out very well, and why didn't it work out very well? So it's a process. And now scaling, listen, we thought we knew everything about orthopedics, orthopedic surgeons, private practice, ran businesses in healthcare, but little did we know about the system outside of what our world is very complex. The distance between me and my patient and the people paying the bills is a whole system we had no idea. We thought we would call up an employer and go, employer, we've got a great idea for you. We can save 20% on your, good luck, right? It just doesn't happen. So keep an open mind, read, learn, process. You know, there's a saying in digital healthcare, fail fast. If you're going to fail fast, learn a lot and start again. that kind of resiliency is critically necessary. And we've made a lot of mistakes, Robert. We make a lot of mistakes. And at first, our board was a little dissatisfied with Jay and I. They said, well, you're too diffuse. You haven't defined product market fit. This is like 4 or 5 years ago. So we don't really have our product yet. We don't even know what market we're in yet. And we dabbled in all these different markets. Now we have a pathway. Now we have a very solid lane, very solid. In fact, several verticals that are very solid. But it took years of testing and curation to find those lanes. I'm not a kid, and I've been in healthcare for a very long time, but I continue to be amazed at how much I learn, like each day and each week. And but we're also very happy to share those secrets with any of your listeners, and we all want to leave it better than we found it.
Wonderful. Well, we just came full circle with our conversation there, and I definitely I can relate to what you're talking about there. Is fail fast and to try to debug the system and try to break it. And you think about like any like popular app you use on your phone or any software, they probably beat that thing up daily, right? They probably have beta testers, bug reports within that company, and they're clicking on like the top of the screen. They're trying to, if there's like a zip code field, they're typing in like letters and numbers. They're doing all these things to just to get to the edge cases, just to be like, well, let's try to find all these ways to beat it up. And in the same way with our learning and with our mental framework and with our company, it's like, let's try to see all the ways that it can go wrong. That way we have a solid system, and that way things can maybe progress and we can kind of move along. And so you mentioned about like sharing the secrets and solving some of these problems. And so how do some people find out more about you, about moving to value and Upswing Health and the rest? What are some next steps, calls to action here?
Yeah, listen, I'm always happy, always open for good conversation. Because again, we do need to pass it forward. All of us who want to fix this system need to work together. We've got some great young people on our team. So I can be reached at Schutzer, SSCHUTZER at upswinghealth.com, or an easier one is steve.schutzer at gmail.com. You can reach out on LinkedIn. Anyway, look at our website, the Moving to Value Alliance, to get a little history of that organization. Membership is free. It's that simple. And again, Upswing Health, if anybody is anywhere in the healthcare ecosystem that sees the value of that top of the funnel approach, not just for orthopedics, but for any discipline you're in, I'm happy to pitch in and help and sort of lead you in the right direction. Anytime, Robert.
Very cool. You accomplished amazing things, and you're also generous as far as sharing what's worked. So that way you can, like we keep saying, leave it better than we found it. So we said upswinghealth.com, movingtovalue.org, and Steve Schutzer, that's SCHUTZER. Find him on LinkedIn. And before I let you go, Steve, it's time to put you on the spot and ask you for a fun quote or lesson. You've read all these books, you've done all these things. Does anything come to mind as far as inspiring us, motivating us with a fun quote or lesson?
Yeah, that's a great one. I study a little bit of Asian philosophy through my martial arts that I've been interested in. And I love Lao Tzu for so many reasons. But, the journey of 1,000 miles starts with that first step. And you just got to take one step after the other. Keep your eye on the ball. Don't let anybody change your mind. Incredible resilience. The other one I like is from Dan Pink, who said, I used to think everything was about time. I now believe time is everything. And we're running out of it in healthcare. So anybody who's interested in collaborating, please reach out. I'm happy to have a conversation. And I thank you for the opportunity, Robert, today.
And thank you for showing up and sharing a lot. I feel like we packed a lot in, and that's very helpful. That time is of the essence. And if you think you have unlimited time, then you won't make a priority of what you really need to focus on. So start making those steps, start making those progress, make those phone calls, talk to people, including Mr. Steve Schutzer, MD himself. If you think that it's a good relation, if you think a conversation is worth having, find him on LinkedIn. Find upswinghealth.com and movingtovalue.org. Thank you for the very fun and enlightening conversation, Dr. Steve.
Thank you, Robert. I enjoyed the time. Anytime.